Hi everyone, we're from Loma Linda University School of Dentistry Dental Hygiene Students Class of 2018. In today's video, we'll be talking about pregnancy and oral health. Pop quiz. We would like to know how familiar you are with some important facts regarding health of you and your baby. Don't worry if you're unsure of some answers. Watch till the end of this video and you'll get them correctly. The first question is, true or false? My oral health does not affect my baby's health. The second question, true or false? If you have morning sickness, you should brush your teeth immediately after vomiting. Third question, which of the following conditions can pregnancy cause? AIDS, pyelogenic granuloma, tuberculosis, or cold sores? Fourth question, yes or no, is it normal to have gingivitis during pregnancy? Fifth question, what conditions can be caused by smoking during pregnancy? Miscarriages, low birth weight, birth defects, developmental disorders, or all the above? Sixth question, true or false? Secondhand smoke does not have an effect on an unborn baby as long as the mother is not smoking. Last but not least, what is the best way to prevent periodontal disease? Eat processed foods, rinse with mouthwash, brush for 2 minutes, and floss daily. Chew sugar-free gum, or brush aggressively for 30 seconds and don't floss. Objectives for today are focusing on what periodontal disease is and how it can affect you and your baby during pregnancy. We will also be talking about the importance of maintaining oral health as well as overall health. And lastly, we'll be showing you ways to prevent oral disease and how to properly take care of yourself during pregnancy. Many people may not know, but your oral health has a huge effect on your overall health. We want to make sure you know how to properly take care of your teeth in order to have a healthy and comfortable pregnancy. Optimal time to visit your dentist is during second trimester. When a mother is healthy, then she will have a healthy baby. Periodontal disease is a disease that attacks your gums, tissue, and the structures that support your teeth, such as your jawbone. It is usually caused by bacteria in your mouth that adheres to the plaque on your teeth. This is why daily plaque removal, such as brushing and flossing, are so important and how they help prevent periodontal disease. Pregnant women are at high risk for developing periodontitis because the fluctuation in hormones makes you more susceptible to oral disease. Other factors such as stress, poor nutrition, smoking, etc. can also increase your risk for periodontal disease. As long as you're brushing and flossing regularly, your chances for getting periodontal disease decrease tremendously. How to brush your teeth. You're going to have your toothbrush angled at a 45-degree angle. You're going to go up towards your gum line and in soft motions. Very slowly, you're going to go against every single tooth surface. You're also going to angle it to be sure that you get every surface of your tooth and continuously move it all around your whole tooth surface. As you come to the inside of your upper teeth, what you're going to do is you're going to do a scoop and scoop everything out of there. And make sure you do it very slowly to be able to get everything. And the same thing goes for inside your lower teeth. You're going to have your toothbrush and you're going to scoop it as well. When brushing your bottom teeth, you're going to want to as well do that 45-degree angle to get towards your gum line, very softly and slowly to get all your tooth surface, and be sure to continuously move your brush as you move forward. How to properly brush your teeth. Piece of floss, what you're going to do is you're going to take it and wrap it around your middle finger as well as this one and wrap it around your middle finger. And you're going to go inside in between your teeth, go down softly, and go back and forth in a C-shaped motion on both sides. Come up softly. One more time, go down in very softly, back and forth to create that C-shaped. Here are some pictures of how to properly floss. Periodontal disease can have many negative effects on your baby while you are pregnant. It can cause premature birth, low birth weight, and long-term disabilities for your child, miscarriages, and preeclampsia, which is dangerously high blood pressure during pregnancy. Periodontal disease is treatable. Getting treatment can benefit both you and your baby.
There are many new changes happening to your body during pregnancy. You may notice some changes happening inside your mouth, which can seem concerning, but they are usually normal. One change in your mouth could be a pyogenic granuloma, otherwise known as a pregnancy tumor. This is a normal change and should go away after you give birth. If this tumor is painful or causing you to have trouble while eating, then visit your dentist and they may be able to remove it for you. Pregnancy gingivitis is also very common during pregnancy. It is also caused by the hormonal changes occurring in your body. Just be sure to keep up with your daily oral hygiene and it should resolve itself after you have your baby. Morning sickness is something that many pregnant women struggle with. It can be very tempting to want to brush your teeth right after you throw up, but it is very important to wait at least 30 minutes after vomiting to brush your teeth. The reason you want to wait is because after vomiting, your mouth becomes very acidic and the enamel on your teeth is very vulnerable. If you were to brush your teeth, then you could damage the tooth structure while it is in its weak state. By waiting 30 minutes, your mouth is not as acidic and you won't risk damaging your teeth by brushing. After vomiting, the best thing to do is either rinse with water or rinse with baking soda in order to make sure your mouth is less acidic. Prenatal care is very important to ensure that your baby is healthy and developing properly. Make sure you are seeing a doctor regularly throughout your pregnancy. It is very important to take your prenatal vitamins because they have many vitamins that pregnant women need in order to grow a healthy baby. One very important vitamin in prenatal vitamins is folic acid. Folic acid helps prevent your baby from developing spina bifida. This picture shows a baby that has myelomeningocele, which is a form of spina bifida where the spinal cord and meninges are exposed to the baby's back. Babies who have spina bifida are usually unable to walk and are severely handicapped. This is why prenatal care and prenatal vitamins are so important during pregnancy. Healthy eating during pregnancy is vital to your baby's growth and development. Here is a chart of do's and don'ts when it comes to nutrition during pregnancy. Some of the main things you want to avoid is undercooked meats and fish such as sushi. You want to make sure you wash your fruits and vegetables before eating them. Also, you don't need to eat for two while you're pregnant. You only need about an additional 340 calories per day during pregnancy. If you eat too much during pregnancy, then your child is at higher risk of obesity later in life. Make sure to get plenty of nutrients and protein, and try to avoid simple carbohydrates. Make sure you do not diet while you are pregnant because this could cause your baby to lack vital nutrients during development. Make sure you eat often and drink plenty of water. It is important at this point in life to reconsider the risks of tobacco on you and your future baby. Tobacco contains many harmful chemicals that manifest into deadly illnesses. Some of these include low birth weight, premature birth, sudden infant death syndrome, stillbirth, birth defects, respiratory issues, behavioral problems, and learning disorders. Remember, you are at a pivotal point in your life where you can make a difference for not only you, but your child. This can be a fresh beginning to a new healthy life without smoking. Remember, quit for you, quit for two. Secondhand smoke refers to being exposed to smoking even if you are not partaking on it. It can be even more harmful because your body is not accustomed to the variety of chemicals there is in a single cigarette. It is crucial to take a stand in protecting yourself and your baby from unhealthy environments that will expose you to unhealthy air pollution. In most cases, one gets affected the most by secondhand smoke from one's own home, where loved ones are having a difficult time quitting. Some resources are listed below to help your loved ones quit smoking.
Alcohol use during pregnancy can harm your baby in many ways. Fetal alcohol spectrum disorder is a term used to describe the group of conditions that can occur in a person whose mother drank alcohol during pregnancy. These effects can include physical problems and problems with learning and behavior. Usually, a person with fetal alcohol syndrome has a combination of these problems. These problems associated with fetal alcohol syndrome are 100% preventable. Completely abstaining from alcohol is the only way to be sure that your baby will be safe from FASD. Today we learned about periodontal disease and how it can have harmful effects during pregnancy. We also discussed bass brushing technique and the C-shaped flossing technique. We also reviewed how important proper nutrition and prenatal care are for developing babies. It is important to remember that brushing your teeth immediately after vomiting can cause damage to your teeth. And don't be alarmed if you have a pregnancy tumor or gingivitis while you are pregnant. It should go away soon after you have your baby. Remember that a healthy mom makes a healthy baby. Remember that pop quiz at the beginning of this video? As promised, we will be reviewing the answers and you can compare your first answer choices to what you would answer now after watching this video. The first question, my oral health does not affect my baby's health. It is false. The second question, if you have morning sickness, you should brush your teeth immediately after vomiting. False. Third question, which of the following conditions can pregnancy cause? AIDS, pyogenic granuloma, tuberculosis, or cold sores? It is pyogenic granuloma. Fourth question, yes or no, is it normal to have gingivitis during pregnancy? It is normal. Fifth question, which condition can be caused by smoking during pregnancy? Miscarriages, low birth weight, birth defects, developmental disorders, all of these. Sixth question, true or false, secondhand smoke does not have an effect on an unborn baby as long as the mother is not smoking. It is false. Last but not least, what is the best way to prevent periodontal disease? Remember, brushing your teeth for 2 minutes and floss daily. To reinforce what we learned today, remember the importance of good oral hygiene in order to prevent diseases like periodontal disease. Here are some pictures you can refer back to remember the bass brushing technique and C-shaped flossing technique in order to make them a part of your daily routine. If finances are keeping you from visiting the dentist, here is a link that lists all of the low-cost dental clinics in the Inland Empire. Another resource is texting 222-888 that provides help to pregnant women in quitting smoking. Please do not hesitate to take care of your health. You will be doing yourself and your baby a huge service by visiting the dentist. Thank you for watching. Make sure to tune into our next video.